If your knees ache when you get up in the morning, or your hands feel stiff before you've even had coffee, this video is for you. Joint pain after 60 isn't something you just have to live with. And it's not always something that requires surgery or daily painkillers either. There's an ancient root used in traditional medicine for thousands of years that modern research has confirmed actually reduces inflammation in the joints, often within days of consistent use. Stick with me, because I'll walk you through exactly what it is, how it works, and how to use it properly. Joint pain after 60 usually comes down to a few overlapping issues. Issue 1. Cartilage naturally thins with age. The cushioning between your bones gradually wears down over decades of use, which means less shock absorption and more friction at the joint. Issue 2. Chronic low-grade inflammation. As we age, the body tends to run a baseline level of inflammation that didn't exist in younger years. That inflammation directly irritates joint tissue, causing stiffness and pain, especially noticeable first thing in the morning after hours without movement. Issue 3. Reduced synovial fluid. This is the natural lubricant inside your joints. Production slows with age, which is part of why joints can feel creaky or stiff, particularly in colder weather or after sitting for a long time. Conventional treatment often jumps straight to anti-inflammatory medication or eventually surgery, but there's a natural anti-inflammatory that's been studied extensively and addresses this from a different angle. The root I'm talking about is turmeric, specifically its active compound, curcumin. Turmeric has been used in Ayurvedic and traditional Chinese medicine for over 4,000 years, primarily for inflammation and joint complaints. What's notable is that modern clinical research backs this up. A 2014 study published in the Journal of Medicinal Food compared curcumin directly to ibuprofen in patients with knee osteoarthritis. The results showed curcumin was comparably effective at reducing pain and improving function, without the gastrointestinal side effects associated with long-term NSAID use. A separate meta-analysis reviewing multiple clinical trials found that curcumin supplementation significantly reduced pain scores and improved physical function in osteoarthritis patients within 4 to 8 weeks of consistent use, with some people noticing improvement in the first week or two. Here's why it works. Curcumin inhibits specific inflammatory pathways in the body, including enzymes called COX2 and substances called cytokines, which are directly involved in joint inflammation. It's essentially working through a similar mechanism to anti-inflammatory medication, but from a plant compound rather than a synthetic drug. One critical detail: curcumin on its own is poorly absorbed by the body. Without help, most of what you consume passes through largely unused. Here's how to take turmeric in a way that your body can actually absorb and use. The absorption problem and fix. Black pepper contains piperine, a compound that increases curcumin absorption by up to 2,000%. Without black pepper, turmeric on its own does very little. This single detail makes or breaks the results. The basic preparation: 1 teaspoon turmeric powder, a pinch of black pepper, non-negotiable, 1 tablespoon healthy fat, olive oil or coconut oil since curcumin is fat-soluble and absorbs better with fat present. Mix into warm water, milk, or a smoothie. Take this once or twice daily, ideally with meals, since taking it with food further improves absorption. Alternative: golden milk. Warm a cup of milk, dairy or plant-based. Add a teaspoon of turmeric, a pinch of black pepper, a small piece of grated ginger, and a teaspoon of honey. This is a traditional preparation that combines absorption-boosting fat with anti-inflammatory ginger as a bonus. Important caution: If you take blood thinners, have gallbladder issues, or are scheduled for surgery, talk to your doctor before adding turmeric supplements. It can interact with certain medications and affect blood clotting. Here's a realistic timeline based on the clinical research. Days 1 to 3. For some people, the anti-inflammatory effect starts to build immediately, though noticeable pain reduction varies by individual and severity. Week 1 to 2, many people in clinical studies began reporting measurable reductions in pain and morning stiffness during this window. Weeks 4 to 8. This is where the research shows the most consistent, measurable improvement in both pain scores and physical function, comparable to standard anti-inflammatory medication in several trials. Results vary depending on the severity of joint damage, consistency of use, and individual factors. Turmeric isn't going to regrow cartilage that's already significantly worn down, but it does meaningfully reduce the inflammation driving daily pain and stiffness for many people. Joint pain doesn't have to mean immediately jumping to medication or surgery as your only options. Turmeric with black pepper and a healthy fat is simple, inexpensive, and backed by real clinical research, not just tradition. Take it consistently, give it a few weeks, and if your pain is severe or worsening, please still see a doctor. Turmeric supports inflammation management, but it doesn't replace a proper diagnosis if something more serious is going on. Let me know in the comments, where do you feel joint pain most? And have you tried turmeric before? I read every comment. Share this with someone dealing with joint pain who's looking for a real, honest option. See you in the next video. Take care of yourself.